So glomerulonephritis is a term that refers to a group of kidney disorder characterized by inflammatory injuries in the glomerulus, most of which are caused by an immunological reaction. So inflammation injury in the glomerulus. So in these two pictures, the normal glomerulus and this is the glomerulonephritis. First of all, we have to know what is glomerulus. The glomerulus is a network of the small blood vessels or capillaries. In this capillaries inside the kidney or located at the beginning of nephron in the kidney. Each of the two kidney contain about 1 billion nephron. So this glomerulus, when inflamed or inflammation is occur, we call glomerulonephritis. So glomerulonephritis is the inflammation of the tiny filter in the kidneys we call glomeruli, and glomeruli remove excess fluid and electrolyte and waste product from the bloodstream and passes them into the urine. So when inflammation occurs in glomerulus, definitely electrolyte imbalance occur, waste product accumulate in the body. So what are the normal pathology? It is antigen antibody complex occur or antigen antibody complex collected in glomeruli and causes the inflammation and reduce the glomerular filtration rate. This picture, normal kidney, but here this is the antigen antibody complex formation and GFR reduce glomerulonephritis. So result in proliferation and inflammatory change within glomerular structure, destruction, inflammation, and sclerosis of glomeruli of the both kidney occur. Loss of kidney function develop. Next, glomerulonephritis, inflammation of glomeruli result from an antigen antibody reaction and produced by an infection elsewhere in the body. So maybe patient present with a sore throat and then untreated or maltreated, this organism or bacteria go to the kidney and causes inflammation of glomeruli, antigen antibody reaction occur. So this is one showing renal pyramid and inflamed glomeruli and patient present with proteinuria and hematuria. So usually patient give the history of recent streptococcal sore throat infection. Most common presentation, oliguria, right, or hypovolemia. So now, what are the causes? Immunological disease, autoimmune diseases, or group A, beta hemolytic streptococcal infection of the pharynx, larynx, or the kid skin. So in this picture, we can see impetigo in the kid skin, and this picture showing, explaining maybe sore throat because of group A beta hemolytic streptococcus. If both cases is untreated, not treated, maltreated, And these two infections can cause glomerulonephritis in the kidney. Also, history of the pharyngitis or tonsillitis 2 to 4 weeks before onset of symptom. Type acute occur 2 to 3 weeks after streptococcal infection, and chronic may occur after the acute phase or slowly over time. Glomerulonephritis complication like kidney failure, hypertensive encephalopathy, seizure, pulmonary edema, and heart failure. So what are the data collection? Periorbital or facial edema that is more prominent in the morning. So in this picture, we can see facial edema and periorbital edema as well. Anorexia, decreased urine output, cloudy, smoky, or brown color urine. So some patients present with oliguria or brown color. It is easy to remember Coke color urine, Coca-Cola color. And also sign symptom hypovolemia like hypertension, dyspnea, or edema. What else? So other sign symptoms like pallor, irritability, and lethargy. In older client, present headache or older child, abdominal or flank pain, and dysuria means burning sensation during urine. Hypertension, proteinuria that is produce a persistent or excess foam in urine. So if urine is too foamy, means excess protein passing through. Azotemia means nitrogen contained substance increase in the blood. So azotemia is one of the presentation that kidney does not work well. Because azotemia, also known as uremia, condition where there is abnormal high level of waste product in blood due to kidney failure. Increase the blood urea nitrogen and creatinine level, increase anti-streptococcal O titer. So if you go for laboratory or diagnostic test in blood, we will get increase the creatinine, increase blood urea nitrogen, increase WBC, ESR, and positive ASO titer. This is called streptolysin O titer positive, used to diagnose disorder caused by streptococcal infection, shortly called ASO titer positive. And if we go for urine analysis, we can get hematuria, hematuria, and proteinuria. Also increase the urine specific gravity. And if you go for throat culture, positive for group A, beta hemolytic streptococcus, right? So this bacteria, we need to give antibiotics for infection, diuretics for edema, or antihypertensive for high blood pressure, corticosteroid as well. So what are the nursing care? Monitor the vital sign and daily weight measurement. If daily body weight is increased, means fluid retention, intake and output chart maintained. So strictly maintain input and output, daily body weight, and decrease fluid intake, decrease sodium intake, and also decrease protein intake. Measure the daily weight at the same time of the day during the same scale. Using same scale and also wearing the same cloth. Limit activity, provide safety measure. Diet restriction of sodium depends on the stage and severity of disease, especially the extent of edema. In addition, potassium may be restricted during period of oliguria. Monitor for complication like kidney failure, hypertensive encephalopathy, seizure, pulmonary edema, and heart failure. What else? What are the other intervention? We assist to admin diuretics, antihypertensive for high blood pressure, and antibiotics for infection control like persistent streptococcal infection. Initiate the seizure precursor and assist to admin anticonvulsant as prescribed for seizure associated with hypertensive encephalopathy. Reinforce instruction to the parents to report the sign of bloody urine, hematuria, headache, and edema. Enforce, educate to the parents that the child needs to obtain appropriate and adequate treatment for infection, especially for sore throat, upper respiratory infection, and skin infection, because this is the source of infection and chance to antigen antibody complex collected in glomeruli and causes the inflammation of glomerulus. Measure the daily weight and monitor for weight changing are the most useful and effective method for determining the fluid balance.